Welcome to Boxed in Health, where knowledge and wellness converge, sparking transformative journey to better you. Today, we uncover the topic of diabetes. Diabetes mellitus encompasses a collection of conditions affecting the body's utilization of blood sugar, known as glucose. Glucose serves as a vital energy source for muscle, tissue cells, and the brain. The primary cause of diabetes varies based on its type. Nevertheless, regardless of the diabetes type, it can result in an excess of sugar in the bloodstream, leading to severe health complications. Persistent forms of diabetes include type 1 and type 2 diabetes, while potentially reversible forms comprise prediabetes and gestational diabetes. Prediabetes occurs when blood sugar levels surpass normal ranges but haven't escalated to diabetes levels. If left unmanaged, prediabetes may progress to diabetes. Gestational diabetes manifests during pregnancy and typically resolves postpartum. The symptoms of diabetes can vary based on the level of your blood sugar. Some individuals, particularly those dealing with prediabetes, gestational diabetes, or type 2 diabetes, may not experience noticeable symptoms. In contrast, type 1 diabetes tends to manifest with rapid and severe symptoms. Indicators of both type 1 and type 2 diabetes encompass increased thirst, frequent urination, unintended weight loss, detection of ketones in the urine, which are a result of muscle and fat breakdown due to insufficient insulin, persistent fatigue and weakness, mood swings or irritability, blurred vision, delayed wound healing, susceptibility to various infections like gum, skin, and vaginal infections. Type 1 diabetes can commence at any age, often beginning in childhood or adolescence. On the other hand, type 2 diabetes, the more prevalent form, can develop at any stage of life. To grasp diabetes, it's essential to comprehend the body's regular utilization of glucose. Insulin, a hormone originating from the pancreas, a gland situated behind and below the stomach, plays a vital role. The pancreas releases insulin into the bloodstream. Insulin facilitates the entry of sugar into cells, thereby reducing sugar levels in the blood. As blood sugar decreases, so does insulin secretion from the pancreas. Glucose, a type of sugar, acts as the primary energy source for cells constituting muscles and various body tissues. Glucose is derived from two main sources, food and the liver. Sugar is absorbed into the bloodstream, gaining cellular access with the assistance of insulin. The liver both stores and produces glucose. When glucose levels are low, such as during fasting, the liver converts stored glycogen into glucose, maintaining glucose levels within a standard range. In all cases, sugar accumulates in the bloodstream due to inadequate insulin production by the pancreas. The risk factors for diabetes vary based on the type of diabetes. A family history of diabetes may be a contributing factor across all types. In cases of type 1 diabetes, family members of individuals with this condition may undergo testing to detect the presence of diabetes-related immune system cells, known as autoantibodies. Certain racial and ethnic groups, such as Black, Hispanic, American Indian, and Asian American individuals, face a higher risk of developing type 2 diabetes. Moreover, prediabetes, type 2 diabetes, and gestational diabetes are more prevalent among individuals who are overweight or obese. The longer you live with diabetes, especially if your blood sugar isn't well managed, the greater the risk of developing complications. Notably, prediabetes can progress into type 2 diabetes. Some potential complications include cardiovascular disease. Diabetes significantly heightens the risk of various heart issues, such as angina, chest pain, heart attack, stroke, and atherosclerosis, narrowing of arteries. Diabetic neuropathy. Excessive sugar can harm the tiny blood vessels, capillaries, nourishing nerves, primarily in the legs, causing sensations like tingling, numbness, burning, or pain starting at the extremities and moving upwards. Nerve damage linked to digestion can result in issues like nausea, vomiting, diarrhea, constipation, and erectile dysfunction in men. Diabetic nephropathy. Diabetes can harm the intricate filtering system of the kidneys, made up of millions of tiny blood vessel clusters, glomeruli, that filter waste from the blood. Diabetic retinopathy. Diabetes can harm the eye's blood vessels, potentially leading to blindness. Foot complications. Nerve damage or poor blood circulation in the feet increases the risk of numerous foot-related issues. Skin and mouth problems. Diabetes may make you more susceptible to skin problems, including bacterial and fungal infections. Hearing impairment. People with diabetes are more likely to experience hearing problems. Alzheimer's disease. Type 2 diabetes might heighten the risk of dementia, including Alzheimer's disease. Diabetes-related depression. Symptoms of depression are common in individuals with both type 1 and type 2 diabetes. However, when blood sugar levels remain untreated or unregulated, both you and your baby could face complications. For the baby, gestational diabetes can result in overgrowth. Excess glucose crossing the placenta stimulates the baby's pancreas to produce extra insulin, potentially causing excessive growth. Low blood sugar. Babies born to mothers with gestational diabetes might experience low blood sugar, hypoglycemia, shortly after birth due to heightened insulin production. Type 2 diabetes risk. Babies born to mothers with gestational diabetes face an increased risk of obesity and developing type 2 diabetes later in life. Fatality. If left untreated, gestational diabetes can tragically result in the baby's death either before or shortly after birth. You should follow these steps for prevention. Opt for nutritious foods. Choose foods that are lower in fat and calories while being rich in fiber. Embrace physical activity. Incorporate approximately 30 minutes of moderate aerobic exercise most days of the week. Alternatively, aim for a total of at least 150 minutes of moderate aerobic activity weekly. Manage weight. Shedding excess weight, even a 7% reduction in body weight if you're overweight, can significantly reduce the risk of developing diabetes. Consider medications. In some cases, medications like oral diabetes drugs, e.g., metformin, can be an option, particularly for reducing the risk of type 2 diabetes. If you have prediabetes, ensure you have your blood sugar checked annually to monitor for the development of type 2 diabetes. Working towards sustaining lasting changes in your dietary habits and physical activity levels is key to maintaining a healthy weight. Diagnosis. The A1C test is a blood test that gives a picture of your average blood sugar level over the past 2 to 3 months. This test measures the percentage of blood sugar that's linked to hemoglobin, a protein that carries oxygen in red blood cells. If you have an A1C level of 6.5% or higher in 2 separate tests, it's a sign of diabetes. A level between 5.7% and 6.4% indicates prediabetes. Below 5.7% is seen as normal. The random blood sugar test involves taking a blood sample at any time. If your blood sugar level is 200 mg per deciliter, milligram per deciliter, or higher, it suggests diabetes, regardless of when you last ate. In the fasting blood sugar test, a blood sample is taken after you haven't eaten anything overnight, fasted. A level below 100 mg per deciliter, 5.6 millimoles, L, is considered normal. Between 100 and 125 mg per deciliter, 5.6 to 6.9 millimoles, L, is seen as prediabetes. If it's 126 mg per deciliter, 7 millimoles, L, or higher in 2 separate tests, it indicates diabetes. For the glucose tolerance test, you fast overnight, measure the fasting blood sugar level, and then consume a sugary drink. Blood sugar levels are monitored for the next 2 hours. A level below 140 mg per deciliter, 7.8 millimoles, L, after 2 hours is normal. If it's over 200 mg per deciliter, 11.1 millimoles, L, it suggests diabetes. Between 140 and 199 mg per deciliter, 7.8 to 11.0 millimoles, L, means you have prediabetes. If your healthcare provider suspects type 1 diabetes, They may test your urine for ketones, a byproduct produced when the body uses muscle and fat for energy. During pregnancy, especially if at high risk for gestational diabetes, early screening may be done. High-risk individuals may be tested for diabetes during their first prenatal visit, while those at average risk typically get screened in the second trimester. Depending on the type of diabetes you have, your treatment may involve monitoring your blood sugar, taking insulin, and using oral medications. For all types of diabetes, maintaining a healthy weight through a balanced diet and exercise is essential for both diabetes management and overall well-being. Eating healthily involves following a diabetes-friendly meal plan that helps regulate your blood sugar levels. Regular physical activity is important for everyone, including those with diabetes. Engaging in aerobic exercises helps lower blood sugar levels by facilitating the movement of sugar into your cells, where it's utilized for energy. Physical activity also increases your body's sensitivity to insulin, meaning you require less insulin to transport sugar to your cells. Aim for at least 30 minutes of moderate physical activity most days of the week, totaling at least 150 minutes weekly. Additionally, avoid prolonged periods of sitting. Try to stand and move around if you've been sitting for more than 30 minutes. For type 1 diabetes, the main treatment involves using insulin through injections or an insulin pump, frequent blood sugar checks, and keeping track of carbohydrates. In the case of type 2 diabetes, managing the condition primarily focuses on lifestyle adjustments, regular blood sugar monitoring, and possibly using oral diabetes medications, insulin, or a combination of both. Monitoring is essential to ensure your blood sugar remains within your target range. Those on insulin therapy might opt for continuous glucose monitoring, a technology that offers valuable insights into blood sugar trends, reducing the need for frequent finger sticks. Despite occasional unpredictable changes in blood sugar levels, diligent management and support from your diabetes treatment team will help you understand how various factors like diet, exercise, medications, illness, alcohol, stress, and hormone levels affect your blood sugar. If your A1C level is higher, adjustments may be necessary in your oral medications, insulin routine, or meal plan. Insulin is vital for those with type 1 diabetes to manage blood sugar and sustain life. Additionally, many people with type 2 diabetes or gestational diabetes may require insulin therapy. There are various types of insulin available, each serving specific needs throughout the day and night. Insulin cannot be taken orally due to stomach enzymes interfering with its action. It is typically injected using a fine needle and syringe, or with an insulin pen, resembling a large ink pen. An insulin pump is another option, worn externally and connected to the body through a tube, allowing precise insulin delivery based on meals, activity levels, and blood sugar. Innovations in technology have led to tubeless insulin pumps, which can be wirelessly programmed to dispense insulin as needed, aligning with meals, activity, and blood sugar levels. Additionally, closed-loop systems, implanted in the body, link continuous glucose monitors to insulin pumps, automating insulin delivery based on real-time blood sugar readings. Apart from insulin, your healthcare provider may prescribe oral or injectable medications to manage your diabetes. These drugs can enhance insulin release from the pancreas, reduce glucose production by the liver, slow carbohydrate absorption, or increase insulin sensitivity. SGLT2 inhibitors, a type of medication, work by preventing the kidneys from reabsorbing sugar into the blood, causing the sugar to be eliminated through urine. For some individuals with type 1 diabetes, a pancreas or islet cell transplant might be a consideration, offering the possibility of no longer needing insulin therapy. However, these procedures carry risks and often necessitate lifelong immune-suppressing drugs to prevent organ rejection, with reserved use for those whose diabetes is challenging to manage or require concurrent kidney transplant. Certain individuals with type 2 diabetes, particularly those with a body mass index over 35, may find relief in specific bariatric surgery procedures. Gastric bypass, for example, has shown significant improvements in blood sugar levels for those who've undergone the procedure, although the long-term effects on type 2 diabetes remain under ongoing research. For gestational diabetes, effectively controlling your blood sugar is crucial to ensuring your baby's health and reducing complications during childbirth. This includes maintaining a healthy diet, regular exercise, and monitoring blood sugar levels. If you're dealing with prediabetes, lifestyle adjustments play a central role in treatment. Adopting healthy habits to maintain a healthy weight through exercise and nutritious eating can bring your blood sugar levels back to normal or prevent them from escalating towards the levels seen in type 2 diabetes. Additionally, certain medications like metformin, statins, and high blood pressure drugs may be considered for individuals with prediabetes, especially if they have other medical conditions like heart disease. If you enjoyed today's video, don't forget to like, share and subscribe for more informative content like this. Thank you for watching. See you again with another video.